Good morning. In studio, we do have Naireen Louw. Naireen, good morning.
Good morning.
How are you?
I'm good. How are you today?
I'm good. Welcome to the show.
Thank you.
And today being Thursday, it is Mental Health Thursday. And we want to look at an incident that took place last week. There was a post on social media where a lady ended her life.
Right.
And when I looked at this, it was a bit traumatizing because I remember the message that she had sent to when it's a family member or a brother. And she said that by the time you're finding this by the time you're reading this message, I'll be gone. Right. Mm-hmm. And she also identified where her body would be. And you could tell the pain in the brother's voice. Mm-hmm. Right. So then I went to social media. I'm trying to see, okay, what's going on? Then there were a lot of posts. And if you look at the comment section, a lot of people are saying she was reaching out. Mm-hmm. You know, that she was reaching out. Her messages were reaching out. Mm-hmm. Yeah, it's more like a cry for help when I say certain things. And somebody said she was reaching out, but nobody noticed it.
Right.
And this happens a lot where somebody's going through something traumatic. For the lady in question, she lost her daughter, very traumatic again. And I think dealing with loss was overwhelming. Mm-hmm. And then also there was money involved, debt. So you can tell that there was a lot going on. Mm-hmm. And in her posts, somebody said she was reaching out. And I've seen this with people, even mm-hmm. around me.
Right.
How do we identify a cry for help?
Mm-hmm.
Yeah.
Well, the thing with cases of suicide, it's very personal to each individual.
Yeah.
Right? And, hindsight is clear. We can always say, oh, this is what they meant, this is what they were trying to do. And there are definitely signs that you can look out for. But in most cases, someone will tell you very clearly that I want to end my life, I want to take my life. They will attempt after saying so. They tend to attempt. And unfortunately, in some cases, the attempt does end up in them losing their lives. But in some cases, again, the person will keep on going back to the suicidal attempts. So there's not really a specific list of things that you'll look out for, except for the person coming out and saying, I'm not okay, I need help, I need some sort of support. Now, what happens with people and families usually is that they downplay. They think this is attention seeking. They think that this is the person trying to be extra, especially when it happens with adolescents or people who are abusing substances, things like that. There's already a behavioral issue at play, and then comes the attempt.
Yeah.
And then also, again, now we have the most common reason, I could say, because there are different reasons someone would end their life, would be depression. Now, depression does have signs. So with that, you can look out for, and I have had clients come and say, oh, I didn't know that's what I should have looked out for, or with their family members, that's what I could have looked out for. Is that what you would like me to expound on?
I think so, because it starts from somewhere. And when you say depression, it has to start from somewhere. Even for somebody to get to a point of saying that I'm thinking of killing myself or taking my life, there's something that overwhelmed them.
Oh,
so
sure.
If it's starting from depression, how would it manifest in a subtle manner? Like, how does it look like?
Now, depression, again, there are people who are functional and depressed. So they're high functioning depressed. So that's why you find sometimes with celebrities, you'll find someone was at a party the previous night and the next day they're gone.
Yeah.
Someone will say, but I was with them and they were fine. We were joking. We went out for dinner. They were fine. That's high functioning depression. And I'll go into what that looks like. But for depression, the onset of depression is just 2 weeks. That's it, just 2 weeks. And it goes with things that are behavioral, so you can notice. And this is where it needs someone who can notice. You need to be keen with the people around you. It goes with appetite change. So either someone putting on a lot of weight or losing a lot of weight. It goes with insomnia or hypersomnia. So someone not sleeping at all or someone sleeping too much. Fatigue, lethargy. irritation, annoyance. They're not fulfilling their goals, usually at work, if we're talking about an adult, or at school. And or if they're highly functional, they're hyper focused on their work. So you know how we have the people who show up at work, you're supposed to start at 8 a.m. They're there by 6. They're the last ones to leave. Those are telltale signs, not necessarily of depression, but of something's going on. There's something not quite right. Reliance on substances. So substances can be anything, from the most common is alcohol because it's legal, to any other drugs, to even food as a source of comfort, online games, gambling. So it's really behavioral, and you need to have a keen eye for the people around you, just to notice who's been coming to work late, who doesn't look as clean. Hygiene is another thing that goes with depression. Either they'll become hyper clean, or the hygiene will go completely. So you'll find someone is not bathing like a month, and it's Mombasa, so you're wondering, like, this person's not okay. And usually we feel, that social thing of, you haven't brushed your teeth, but you don't want to say anything, and you'll find people just avoiding this person. But we need to become more comfortable in how we communicate with people in a very clear way, but not in a way that harms them. So like, if, for example, I noticed that if I worked with you and I noticed, like, you're not looking as sharp as you used to, I could just take you out for a cup of tea and ask you if everything's okay. Or if most companies have like medical insurance, escalate the issue to a manager and ask them to get this person in to see a mental health professional.
Okay. So my problem now, we are here, we are 3, we are 4 plus you. I'm having issues. How would you detect, for the example that you've given out, celeb, you've gone for a party, hey, kesho hayuko, and nilikuwa naye, I was with him yesterday, that means you didn't know. So for this instance, how can you depict that?
It's difficult because they're masters at masking. And in fact, you'll find most comedians are either the ones who commit suicide or have the most issues with abuse of substances or with violence, and you'd wonder, like, this person seems so jolly all the time. But no, they're masters at masking, and it usually comes from deep issues from the time of childhood. You know how our parents would hit you and then they say, Lia wone,
Yes.
And you're forced to learn how to mask.
Yes.
I'm in pain physically. I'm in pain maybe emotionally. And your parent, who is supposed to be your guide to life, is telling you, mask it. So you grow up masking it. And it's worse with men because men don't have the social acceptance to let out their emotions. So for example, I could walk into a coffee shop and see a woman crying and I'd be concerned, but it wouldn't be like, oh my goodness. But if I saw a man crying, and then that's a big deal. There's something going on here, and that's why we see most of the cases of people ending their lives are with men. So to answer your question fully, when someone is what you're describing is a high functioning depressed person with depression, is you cannot be a mind reader. And that's where I want the people who survive, the family members, the friends, to give themselves some grace, because you're not mind readers. You're not able to read someone's emotions. Emotions are invisible, thoughts are invisible. So unless I communicate it to you through my behavior or verbally, non-verbally in some way, there's no way you can know what's going on in my life. I mean, just sitting here with the 3 of you, there's no way I'd know what you're going through, or either of you, unless you told me.
Now, sometimes we have the cases where you're actually seeing some challenges in them. Decide maybe to take them out for a coffee, but they decide not to share anything. So like, me niko sawa, I'm just okay. But the reality is where you are seeing a lot of changes in them. Na kuna some cases you try maybe refer them to some is it psychologist or so,
Yeah.
but still cooperate.
Yeah.
Sasa in such scenarios, what do you do?
It's difficult because we call them resistant clients, and it happens a lot when families bring in people who have some mental disorders, like schizophrenia. I'm sure you've heard of it. It means, you have hallucinations, paranoia. So they may look at the therapist or the doctor as someone who is trying to harm them. Adolescents for psychologists, we group it from 10 to about 21, 22. It's a huge subsect. So you have someone bringing in their adolescent and they're just silent the entire therapy session, or like you said, someone who is maybe using some sort of substance. You're noticing something's off here, but when you bring them into therapy, or in some cases the family will force them to go into rehab, there's nothing that can be done. It needs the person, the individual themselves, to want to get better in the cases of substance abuse. For the medical ones, like actual depressive disorder or schizophrenia, there are medications that they can be basically forced to take, and they'll be hospitalized to make sure that they're safe. But in the instance that you're talking about, it's someone who's maybe been triggered. Maybe there's a death in the family and you see like they go, or they're going through divorce, or a child dies, like in this case. The best thing to do, instead of suggesting, okay, here I have Naireen's number, give her a call. It's very rare that they'd call. I'd prefer that you call me and we arrange a group session. So I'd come over for maybe art therapy or something, and we'll bake or we'll do something. But while we're doing that, we're talking. And then I know how I want to take the conversation. So I'll lead it in such a way that this person becomes safe, they feel safe with me, and then we can take on one-on-one therapy later. And again, it's not always that the person will take it up. So you may notice that, this person's not okay. If it's an adult, it's the best you can do is maybe get them to, like I said, call the psychologist and ask them to have a group session with you. If with psychologists, one thing is we're a helping profession. So if they can't afford, always ask the psychologist. Don't be shy. Ask if they have pro bono services. Most of us have that option. Even if we don't have an available space at the moment, we'll always refer. There are so many organizations that offer mental health services for people at a subsidized price or completely free. There's always something you can do.
All right. We are speaking to Naireen Louw. She is a licensed counseling psychologist. We're looking at how to identify a cry for help. You've probably been in such a space, or you've heard somebody's story. What should you do? What question do you have? 0700917917. Good morning. Naireen, before we went on a break, gonna ask a very important question. Like, how do you identify? So you say that somebody might have gone through child loss, okay, loss, divorce, all that, but then they want to willingly offer to go see a psychologist, right? So as a friend, you're supposed to see the signs, reach out to the psychologist, and then have a group session. Why is it hard now for the person who's going through depression, for them to come up and say, okay, I need help?
I'll give you a kind of explain what depression feels like to the person going through it. For those who swim, you can imagine being in the ocean. It's a dark night. The ocean is completely black. For anyone who's driven past, on the Nyali Bridge, you can't even see it. It's absolutely dark. And you can imagine you're under there and you can't swim. So you finally push yourself to the surface, take a breath of air, and the water pulls you down again. And you do it again and again, and it's exhausting. And that's why you find many of them end up saying, I'm done, I'm tired.
You feel like you're drowning.
you're drowning in pain. The pain, and the thing with the brain is this: when the brain can create physical pain, so you're not only in psychological pain, you can actually experience physical pain. And then there are those people who get depression because they are in physical pain. People who have, like, for example, Parkinson's or multiple sclerosis, and these cancer even, you know, the diseases that can push you towards depression. But when you're talking of somebody who's gone through loss, any kind of loss, I think as a society we have all experienced it. As adults, we've all experienced loss of some sort, you know, like someone you love, or even if it's a breakup, things like rejection. People feel very overwhelmed with rejection. So as soon as you notice someone in your life has gone through something, they've lost a job, they didn't get that promotion they wanted, the child is sick, a child has died, partner is sick, partner has died, parents even, it doesn't matter the age of how old you are, losing a parent is painful, you know. Always reach out, try your best, be physically present for the person as much as you can. Check in on them. You know, have you had a shower today? How's the house looking? Has this person eaten? You know, sit with them and eat with them if you can. Get to that point. And then, like I said, now bring in a mental health professional, and the mental health professional now can come in and take over basically and deal with the person from that point.
Okay, so this is also us making an assumption that there are people around this person who might notice. So let's so let's go to that person who might not have people around them who might notice, and you're able to tell when your kind of lifestyle is changing. You know, the things that you used to do, you don't do them anymore.
Yes.
You know, either you're eating more than you would normally eat, and you're sleeping more, or you're just having sleepless nights. Right. So for somebody who is aware, let's say, of, like, you're aware of your patterns, and then you realize my patterns are changing, and you know that my patterns are changing because I'm going through this. You know, what steps should they take so that they may not go under?
It requires a lot of self-awareness, first of all, to know, because sometimes depression gets you and you don't even realize you're depressed. It's a very isolating experience, because naturally when we're hurting, we tend to close up, you know, we become like little tortoises and go into our shell. So it really requires a lot of self-awareness for this person to notice that I'm not okay. I'm not as social as I was, or they could be social in terms of high functioning. You're seeing them, but they're not connecting with you. They're talking, but they're not saying much, you know. You have a lot of people who know them, but nobody truly knows them. You're always having parties and stuff, but no one is really connecting with you in a deeper way, because possibly issues of trust and vulnerability and all that. In the case of adolescents and younger people, then it's up to the caregivers to take notice of these things. But for people who live alone, maybe you're self-employed, so there's not really much interaction you're having with other people, please be very careful about your patterns. You may think it's not, you know, I've had one night I lost sleep, I woke up at 3 a.m. After a week, you know, the second night I can't sleep, then it becomes an everyday thing, and you have someone saying, oh, I don't sleep very well. Like, I sleep 2 hours, and I'm like, that's not normal, you know. And because you're used to it and you're functioning, it becomes your normal. But people need to look at themselves and understand, am I eating in a way that is nurturing for my body, or am I eating because I feel like it excites me, I get a reward, you know, the ding ding in the brain. Am I not eating because I feel in control when I don't eat? Am I sleeping enough? Am I oversleeping? Am I lethargic at work? Am I meeting my work goals?
Yeah.
Am I setting too many goals for myself? Am I doing the things I love to do? What do I love to do in my free time? Maybe someone used to play guitar and the guitar's been gathering dust. Like, when was the last time you picked it up? You know, when was the last time you went to the beach? When was the last time you played, Scrabble with friends? Things like that you don't, it kind of creeps up on you. And it's very, very slow and you don't really notice it. And that's where the danger is that, like I said before, the diagnosis for depression is that you have to have a certain number of symptoms within a 2-week window frame.
Yeah.
That's it. It's just 2 weeks. And you have a depression diagnosis.
Heavy.
Yeah, that is too heavy. Now that one brings to this question. Yesterday here, Miriam confirmed to me that Mimi ni anti. What was that question?
Antisocial.
He thinks he's antisocial. So
Asocial. Asocial, not
Yeah.
antisocial.
Yeah.
Antisocial, it's a common miswording. Antisocial is the people who look out for any rules in society and purpose to break them. So like the people who vandalize, who spray on buildings and break things and break into people's cars and show up to work late, and they're all, vulgar and verbally abusive, physically abusive. That's antisocial. But asocial are the ones who don't like socializing.
Yeah.
asocial.
Yeah.
The what?
You don't like
Asocial.
socializing.
Nini?
Asocial.
Okay.
Where?
Hupendi kuongea na watu.
Sa-
Unapenda kujiekelea maneno.
Sasa jana
Nini gona?
I asked that question because I was told at home,
Uh-huh.
and then I came here and asked them. Miriam confirmed that wewe, but it is true. Gona decided to say, no, live your life. You understand?
Right.
So is this, hiyo umesema is social? Hey, dunia iko very fast. Is that also for my side now that inakaa personal, for my side nao ni watu wawili wamesema hivyo, so nikijiangalia ni kama ambaye it's true, because yesterday I asked that and then I sat down at a time nikaanza kujiuliza, by the way, lakini nikiangalia hapa this move it's somehow true. Somehow at least 60% kuna ukweli.
Right.
Yeah, that so is that also part of what you are explaining, kwamba kuna any problems?
Okay. So with the world, how we work as a society, the majority want everyone to be like them. There was a time people who are left-handed were said to have the hand of the devil. Don't eat with the left hand.
Yeah.
Don't write with your
Yeah.
left hand.
Yeah.
Kids used to be beaten, things like that, because they're fewer. And now we know that it's fine. It's normal. The same thing with being, I'm sure you've heard of things like ADHD, autism.
Yeah.
We
Yes.
call them neurodivergent.
Yes.
So now we know, and for teachers, they're being taught how to deal with children who have those developmental issues, and they can teach them how to function in a different way. Many humans are social creatures. So when we see someone is not socializing, we begin to question, right? And because the ones who love socializing are more, they look at the asocial ones like, you're not quite like us. We want you to be more social like us. But there is a difference between isolation and solitude. Not to be, funny with words.
I think break that down so that he may understand. Because I think Salim, yes, we were having this conversation about friendships and people we have around us. And he kept saying that he doesn't have those kind of friendships.
Yes.
And he's pretty much, he keeps to himself.
Yep.
A lot.
You're describing me.
Yeah.
That's
yeah.
me too.
Also,
Like he keeps to himself a lot.
We are
Yeah. Yes.
Yeah.
We're many. There's many of us. So the thing is to know when you're solitude. So we enjoy our own company.
Yeah.
Basically, it's very rare for me to leave my home. That's my safe space. I love it. I love being in my home. I will not look forward to a weekend out. It's like, why?
Yes.
So, but there is a difference with isolating. So, for example, if you know that there's a wedding or a birthday party that you have to attend, can you attend it?
No.
then that's isolation.
Yes.
Yeah, that one now I'll give you my number. You so that now there's a fine line.
No,
There's always a
wedding
fine
I
line.
choose, the one I will attend.
Yes. So you can socialize.
Birthday parties, I don't.
Because
Barrio.
it's smaller.
But
People will.
barrio once, one.
Yeah, so there are those social requirements for human beings to with society. You
Yeah.
have to do certain things, but being on your own, wanting your own company, enjoying that company, enjoying solitude. In the past, we used to call them hermits. You know, people who'd live in a cave outside the village and they keep to themselves, right? But now with modern society, we don't have that capacity to accommodate. So you'll find someone will say, oh, that's not okay. But again, like I said, there's a fine line between knowing that this is healthy and this is now crossing over. You're now approaching unhealthy. Like in my case, I realized that I was bordering now on developing agoraphobia, which is a fear of leaving the house. I'd get so anxious about leaving my home that I wouldn't leave. So I knew, this is developing into something else. I need to now force myself to leave the house. And I've kept a requirement for 3 months. Every 3 months I must have some form of social engagement. And from January, like now to March, I haven't had a social engagement. So
Yeah.
it's basically knowing that, why am I afraid? What's going on? Is this normal? With normal being a very shifty word. We don't like using that word.
Yeah.
But is this healthy? Is this healthy for me? So in your case, without having spoken to you a lot, just taking myself as an example, it's more an issue of safety. I don't want issues with people. I don't want a lot of engagement with people, because that will allow me now to take on your issues, and I don't have that bandwidth.
Even
Okay.
Yeah.
this part also of you've mentioned, that nobody knows you. They just see you. Nobody knows who your wife is, and people just know now watoto, but they don't know. Because you've mentioned that part.
Yeah.
That also.
That's just being private. That's okay.
Thank you.
That's okay.
No, like nobody knows.
That's fine.
Yeah,
You don't
it
have
is
to
very
know.
fine.
Like,
don't have to
absolutely
know.
nobody knows.
You don't have to know, because his partner may be, again, asocial. She may enjoy her privacy
Yeah.
and wants
She's
to keep to
outgoing.
herself. But again, it may be that he's not comfortable with engaging such a personal part of his life
With people.
with people. He may be very picky with who gets to meet his wife and his children, which is fine.
Okay. Now, still on his example or his case, there are some people again who come out and share, and we gave him 2 different responses. Like I was telling him, live your life, but these other people are insisting, no, there is a problem.
Yeah.
So would you really advise that if I feel like I'm undergoing a certain depression, is it healthy enough to share with friends? Because especially most of the Kenyans and young people might actually joke around with whatever you are sharing, like hiyo ni kitu ya kawaida ama si ukufe. How do you advise that?
It's you yeah. You said it. People are very, very easy. It's very easy for them to discard what you say, to disregard it. It's not important. It's not that's not a big deal. Everyone goes through that. So kwani wewe ni wa kwanza na kuachwa na bibi, like sheesh, the guy is going through it.
Yeah.
And that's why you'll find somebody will come to work and leave, and then just the next day you find them, they've ended their life, and telling your people, your circle, your friends or whatever, it does have its benefits if they're of that caliber. So again, now it depends on an individual, but like you said, most actually with the let's put it from about 18 to 26, 28, around that age group, they're very, very eager to take care of their mental health, and they're very open to seeking professional help. It's the older ones that we have an issue with. The people who are like mid to late 30s and older. And then we go to like now the people who are in their 50s and older, and those ones are completely resistant.
Yeah.
So you'll find, for example, someone's wife dies, he's in his 60s, his wife dies, maybe a kid dies, and he'll just, be stoic and hardened, that kind of thing. And you can see it's affecting him. You can see, but he's very, very hardened. He doesn't want to get any help. So yes, the friends can be helpful, but it's on the individual themselves to reach out. The good thing with social media now, there's so many mental health professionals. And one thing with a mental health professional, a therapist, you have to find someone who matches with you, because this is someone who's going to journey with you.
Yeah.
And all of us, you must ask for a pre-therapy phone call. You have a chat with this person for about 15 minutes, see if you sync, do you click, and then continue with the therapy with them. Some people will start therapy with someone and then they go like, no, I didn't like that person, and then give up on therapy entirely.
Yeah.
Another thing people need to start doing, the same way we do with dentists, you see them every 6 months, do a 6-month check, mental health check with a professional. Go in and see someone. It's literally an hour in your 6 months of your life. So that's 2 hours in the year, just to make sure you're okay.
Yeah.
Because like I said, some of these issues, they come in and you don't even realize there's something going on. There's a deeper issue going on. And the professionals were trained on how to pick up and how to probe and get you to the point where you're uncomfortable and you can actually bring out your issues.
I like what you said when that you need to find a therapist who matches your energy, again, for lack of a better word. At times you find yourself in a space, and I remember my friend going for therapy, and she had lost someone, and she came back and said the therapist kept on telling her that you'll get through it, No. Yeah, like you'll get through it. These things happen, So I think after that session, she did a couple of sessions, and she said, no, I don't want to go back anymore, So we feel like when you go to a therapist, you just have to pick anybody, anybody who's available. So I like when you say that we can have a chat for me to determine if our energy matches,
right?
Before I even sit and open up to you. So now for the person who's especially for friends, I've identified that a friend is withdrawn, or a family member is withdrawn, or their behavior is different. What kind of support should I offer? Apart from looking for a therapist and saying we need to have a session, what else do I need to offer?
Offer your physical presence, pay them a visit, go and see the house, their home, their personal space. Usually one of the simplest signs is hygiene. So their own physical hygiene. Try and take note about what they're wearing. Are they repeating clothes often? Especially here in Mombasa, it's very quick, to pick up on someone's hygiene not being quite on point. If you're at the point where you know where this person lives, give them a visit. Just pop in and say, oh, hi, I was in the neighborhood,
Yes.
And of course, they'll have to invite you in. We're Africans, and just have a look around, see how does it look. You can also try and see if you can provide for them in some way, like go over with maybe groceries and cook, or that'll give you the opportunity to chat, or go with the meal ready. Oh, I bought pizza. Come, let's eat this together, or whatever it is, and basically try and engage with this person. But again, you're not a mind reader. Give yourself that grace, because even I, as a mental health professional, unless the client, the person I'm talking to, tells me what the issue is, I can't know. There's no test that I can do, a machine that can read your mind. We don't have that. We have machines that can tell me about your brain and, the issues that may be in there, or the chemicals that it's producing. But for how your mind is working, that's why we need to talk. And you need to tell people what you're going through.
Okay. We are speaking to Naireen Louw. She's a licensed counseling psychologist. How do you identify a cry for help. Now, Naireen, when we're going through something, we vent.
Mm-hmm.
And at times we're unable to vent to a friend or even a family member. But social media has become a space where we just let out our emotions. You know, somebody can just take their phone and record themselves crying. You know, and then they just post it on social media. Or just put up a message, a cryptic message, something that one would tell, hey, what's going on? You know, how do we identify, how does a cry for help look like on social media?
It could be as clear as that. Someone saying, you know, I'm not going to be with you next week. Or, you know, crying on social media. Someone looking disturbed or talking about something that they've gone through. That's an actual, very clear cry for help, sorry. And you have issues like the ones, like I said, who mask. And you can't really know. And the thing with social media is that is the playground for people who mask. You know, someone who's showing, oh, look at my happy family. I love you so much. And then and destroy you the next, you know, without the cameras. We really hate each other. And again, we're not mind readers. So if someone is very clear, they're saying that, you know, that they're using specific language. What's the point of life? They've become, they're questioning why am I living? What's the point of all this? They're looking sad, or they're speaking, or they even the affect, the way they're crying, they always look down, you know. Those are very clear. That there's no way for us to say we didn't know. We can see it, they're saying it. And the thing with suicidal thoughts, there's two. There's the passive and there's the active. So passive is someone saying the things that I'm talking about. What's the point of all this? You know, I will end this one of these days. Hamtaniona tena, you know, things like that. Or then somebody like now saying, you know, you don't treat me like I deserve to be treated. One of these days I'm not going to be here, and then you'll see. You know, things like that. And then you have active. Now, when it's passive, take it seriously. When it's active, involve a mental health professional, please. When it's active, that means that the person is saying when, they're saying where, they're saying how. So
when it's active, that's when somebody's saying, you're not treating me well. One day you won't see.
Passive, there's no when, where, how. I just want to end my life. You know, like, what's the point of all this? And I think many of us go through that. When we're going through difficult moments in life, like, what's the point of all this, you know? And it passes. One thing with emotions, like when we teach children, it's emotions are energy in motion. It comes and it goes, you know, like we have the ocean right here. So you watch the waves. It comes up, and then the wave goes away. So ride with that emotion. Just feel it, let it will go, right? And many of us, we're not comfortable with those emotions, right? And then you get to the point where this emotion overwhelms you, to the point that it guides you. It guides your actions. And so because you're sad, and we see this a lot with adolescents, they lack that. They're very impulsive. So because they're overwhelmed with that feeling of failure, I failed my exams, there's no point in life. Boop. You know, my girlfriend broke up with me, my girlfriend cheated on me, my boyfriend rejected me, or whatever it is. They end their lives. And we're like, that's such a trivial reason because we're adults. But for adolescents, that's everything. They're very quick with their emotions. Their emotions overwhelm them. And it happens with adults as well. So when someone is in that state of overwhelm, that's when usually they'll say, you know, I'm going to end this, or let's die together in the case of lovers, you know, like we've seen, like the Romeo and Juliet, it happens in real life. And things like that you see when that person is in overwhelm, and then it goes. But what you need to look out for is when the person has a plan, when they're telling you when, where, how, even if they just have one. So if someone is telling me next Wednesday, you're not going to see me anymore.
Do they say it outright?
They do. They will say it, and writing a suicide letter is not really necessary. Sometimes people don't, and they'll just leave the people who survive them in a lot of confusion. And sometimes nobody reaches out, even on social media, and sometimes they're very clear. So you don't need to have all three, when, where, and how. It's just someone saying, no, na kisu, you know, or going and buying, rat poison or something like that. Be very, very aware, and this person is not, attention seeking isn't necessarily a negative thing. This person is in pain. When it gets to that point, if you feel like, umenisumbua sana, I'm not going to deal with you, get a mental health professional to come in and give the person the empathy that they need, because you have been overwhelmed. It's okay to be overwhelmed, but let someone come in and help this person.
Oh, okay.
Now, this point of having that profession, I think there are assumptions out here that it's very expensive. Sasa hapo ndio mtu unaangalia unaona ni kama tu unaiachilia iende hivyo, because there is that assumption. Is it true kwamba kupata hizo services can be stressful, very expensive? Because najua watu wengi kule nje wanakapitia, lakini that assumption ya kwamba nampata wapi, alafu the charges nini.
Yeah. There are, like I said, we're a helping profession, so there's a lot of therapists who offer pro bono services. Just call any therapist, the one you'll find, and ask, do you offer pro bono services? If they say no, do you know anyone who offers pro bono services? Don't feel shy. We're talking about your care, right? And many of us will offer to a certain subset. So, for example, I offer to anyone who's unemployed. As long as you don't have an income, I'll give you services free, completely free. Or right now, I have a colleague who's offering for women at, I think it's 1,000 bob. For a session until 30th of April. So if you sign up, then for the rest of the time you're in therapy, it's at that reduced price. But therapy goes from anywhere from free, completely free, to subsidized, where you'll pay maybe the therapist's transport, or all the way up to about 10K per session. Depending on the professional and depending on the service they're providing. There's some who even charge in dollars, depending on the service, because we have some people who have studied a specific form of maybe trauma therapy that was very expensive, and they're the only therapist maybe in East Africa who does that therapy. Of course, they're going to charge more for it. Yeah. So it's really for you to look for, it's like how you'd go and see a dermatologist. You'd find the ones who would charge 1,000 bob to see them, and they're the ones who charge 12K to see them for like 10 minutes. Yeah, so it's really you to look at your pocket and where you can be taken care of. Many government hospitals have mental health professionals in place, and there are institutions like the one, I've not found one in Mombasa yet, but there is in Nairobi, Kamili organization. They offer either subsidized or free mental health services.
Okay. My question will come to that part of specifically men who are hard nut to crack. You say they're expert in masking. Singularly umesema wanaume that talent wako nayo. So when it comes to that, is there anything specifically for men wenye tunajua kumask to deal with them in your profession?
Now there's two groups.
Yes.
Again, there's us, the asocial ones, who don't have the boys. I'm going out with my boys. You don't have that circle. It's just you. Then you have to prioritize your mental health yourself. So it's up to you. Like I said, every 6 months, you make sure you're seeing a professional. And when you're seeing a mental health professional, it doesn't mean you're insane. You're going through issues in life.
So here on your routine?
It has to be. You have to have
After
that
6
level
months.
of self-care. Okay? Or, you have to love yourself that much to know to take care of yourself. You want to know your body is okay. You want to know your mind is okay. What's the point of having a fit body? You look very healthy, but you're not taking care of your mind. Once your mind goes, what's left? Just a shell of a human being, right? So take care of your mental health. Then we have the social ones, the ones who have the group of the boys. Even if they're adults, they call them boys.
Boys club.
The boys club, the ones you go and chew with or go and drink with or whatever. And my appeal to them is this: when someone is bringing you their issues to do with mental health, don't disregard it. Don't make it something light. Listen, even if you're not contributing, just listening to someone. Be silent. be quiet and listen, let the person talk.
Yeah.
And something simple you can do is those are prompts. I'm listening to you. Lean in.
Yeah.
Put your phone aside. Give this person your ear. If the issue is something you feel you have the capacity to deal with, help them. If not, find a professional who can come in. And we do have men who are psychologists, counseling psychologists, who can come in and, like I said again, do a group session.
Yeah.
So that it's not a burden on this one person, like you have the issue. No. Yeah.
What does self-care look like?
Self-care means taking care of all the aspects of what makes you who you are.
Yeah.
So taking care of your physical self, taking care of your mental health. Mental means the things that you think about. Taking care of your emotional health. So knowing that, can you regulate your emotions? Do your emotions control you? Can you behave in a normal way, or the way you do, like now you're in equilibrium, you're balanced, right? Does Miriam behave like this when she's angry? Or is she like raging and throwing things and breaking stuff? Or is she extremely calm? There has to be an effect that we can see from your emotions. Self-care also extends now to you knowing what is safe for you, knowing who is safe for you, and taking care of all those aspects of yourself. It also extends to knowing the things, your resources that are so limited. So for example, your time, your money, your energy, your social capacity, your professional life, all these aspects, looking at the different facets of your life and knowing, am I at between 90 and 100% here. And in fact, in my therapy sessions without my clients, now they'll know if they're listening in, but we go through, like, so tell me, how have you been sleeping? Is everything okay? Any nightmares? What did you do that was interesting with your friends? Oh, you didn't go out this weekend. Okay. Do you plan on going out the next weekend? So I'm checking in with them without asking very clinical questions. Are you sleeping enough? Are you eating enough? And those are things you can extend even to your friends. You can ask, like, how's that your exercise regimen going? Are you still going for your walks? And someone will say, no, I gave that up. Oh, okay. What have you replaced it with?
Yes.
So now you know that, okay, this person's not getting the physical activity that they need, or that didn't suit them, this suited them. But again, that's also really exhausting for you as an individual. So you have to be careful to care for a select group of people. You can't be a rescuer and be superhuman and take care of everyone.
Oh, thank you so much. Lastly, how can people reach you?
I can give you my number, and do you want me to say it out?
Do you have a social media platform? I think it's easy for people to
parenting, this parenting thing, KE. I'm mainly focused on parenting, but I do take in clients of any sort, all the way from couples counseling to, the only one I would refer is anyone who's going through addiction. Of any kind.
All right. This parenting thing, KE. Thank you so much. That's how you can find Naireen Louw. It's been very good having this conversation with you. We're taking a break. We'll be right back.
Thank you so much.